I'm here at ESMO this year talking about HLA-restricted therapies, which is a pretty exciting new class of medicines that just in the last recent years have had their first regulatory approvals. So this started in 2022 with Tebentafusp, which is a bispecific T-cell engager that recognizes an HLA-restricted epitope for the treatment of uveal melanoma. And then just recently, this past year, was the first approval of an adoptive cell therapy with a similar type of approach, a medicine called afami-cel, which is used in now synovial sarcoma. And there's a whole plethora of recently opened clinical trials in this large space, which covers both the bispecific T-cell engagers and the adoptive cell therapies that I mentioned, as well as a whole host of vaccine approaches, which all seek to basically raise an immune response against HLA-restricted epitopes. I was specifically talking about at this ESMO an important resistance mechanism in this space, which is HLA loss of heterozygosity. So the HLA expression is really crucial to have the target for all of these HLA-restricted therapies present on the tumor. And in a not insignificant minority of patients, even before they come to our clinic, their tumors will have developed resistance mechanisms, adaptations to escape the immune system. And it's been very hard to test for these types of adaptations, partially because we had no HLA-restricted therapies in the future, so it wasn't really on our radar. Additionally, the assays to do this are challenging, and a lot of these adaptations are subclonal, and so it's an open question in the field what we should be looking for, how we should be looking for it, and how we should interpret loss of heterozygosity when we see it. In particular, we're really interested with how HLA loss of heterozygosity is shaped by neoantigen burden. We found for a particular subset of patients whose tumors have mutations that lead to very immunogenic neoantigens, so things like mutations in KRAS or P53, the hotspot mutations that are quite common, can sometimes lead to very immunogenic neoantigens if the patient expresses the right type of HLA allele. And we found that in these subsets of patients, there's actually an even higher base rate of HLA loss of heterozygosity. Again, really underlining the importance of profiling this in these patients, because they're the same patients that we would potentially treat with these medicines. So I went through a couple of technologies that we've been developing at Memorial Sloan Kettering to answer these questions for our patients, to really identify who will benefit from these medicines, and when patients stop benefiting from these medicines, what went wrong.